Day 30 of Learning Exercise Therapy. A therapist utilizes the results of a symptom limited exercise treadmill test to determine the intensity of exercise for a patient who previously sustained a cardiac event. Which of the following guidelines would be the most appropriate when determining an appropriate exercise intensity for the patient? Answer: 60% of the maximal heart rate obtained on the treadmill test. A therapist assesses a patient's voice sounds as part of a respiratory examination. Which condition is typically associated with increased voice sounds? Answer: consolidation. A 63-year-old female status post stroke is screened for admission into a rehabilitation hospital. A part of the screen, the therapist utilizes a standardized instrument to document the extent of the patient's impairments and disabilities. Which of the following standardized instruments will be most beneficial to provide an assessment of motor function? Answer: the Fugel-Meyer assessment. A physical therapist reviews an initial examination of a patient diagnosed with an upper motor neuron disease. The examination documents the existence of a positive Babinski reflex. A positive Babinski reflex is characterized by: answer: extension of the great toe. A physical therapist examines a patient with lower extremity hypertonicity. All of the following could be used by the therapist to temporarily reduce the tone, except: answer: approximation. Restrictive lung diseases limit to varying degrees the maximum volume of air that can be inhaled and exhaled. Examples of restrictive diseases include all of the following except: answer: emphysema. A physical therapist positions a patient with hemiplegia in a plantigrade position to promote weight bearing through the affected upper extremity. The most appropriate hand position on the plinth is: answer: palmar contact with support of the palmar arches and weight through the heel of the hand.